I want you to feel empowered is really what we're going for. That's really the reason behind all of this is so that you can feel empowered and understand what you can do to achieve your natural menopause fix. You may be feeling a lot of different things and being told that there's nothing you can do, or maybe you're just getting older. And I'm here to tell you, like, hey, that doesn't have to be the case. That does not have to be the case. There's a lot that you can do, other than just feeling like there's a lot you can do other than just feeling like you just have to suffer with what's going on. So I want you to be encouraged in that. All right. So the natural menopause fix, how to stop feeling like a hot mess. That's what we're talking about today. So does this sound like you? Maybe you are the creator of your own personal summers. You're crying and having anger outbursts over nothing. Maybe you're losing connection with your husband or your significant other. Maybe you feel like you're falling apart. You've been told, like, hey, it's just getting older. Suck it up, buttercup. And you're wondering, is this all in my head? Am I going crazy? Some of the signs of what I call the hot mess syndrome might be hot flashes, night sweats, mood swings, the libido has left the room, it's out the door. You've got fatigue and brain fog and weight gain and hair thinning, vaginal dryness. Anybody can relate to that. Can anybody relate to that? Those are the symptoms of feeling like a hot mess. But what if you could wave a magic wand? Wouldn't it be amazing if you could start to feel better, have more energy, more libido, get a good night's sleep? But maybe what you're dealing with right now is that you're feeling like one of these seven menopausal dwarfs. So there's itchy, I'm going to say witchy, sweaty, bloaty, sleepy, forgetful, psycho. Are you feeling like any of these? Are you wondering, like, am I losing my mind here? So before we dive in, let me share a little bit about me. I'm Dr. Malika Woods, medical doctor and healthy lifestyle strategist at Dr. Woods Wellness, #1 best-selling author as well. And my journey into bioidentical hormones actually began with my own personal story. So this picture here on the left, I was 1 year out from having my second kid, my son Makai. That's my daughter Kalia. My husband Thaddeus. We were celebrating our 25th wedding anniversary, which was just last year in Maui before the fires hit. But anyway, up here, top left, I was a year out from having my second kid. I was in a busy OB-GYN practice. I was seeing a lot of patients, 30, 40 a day, being told I needed to see more. I felt disconnected with my patients. I was struggling with my own health. And I really felt embarrassed and ashamed. Like, how can I tell and talk to patients about their health when I was struggling with my own? I knew I needed to do something different. I had to go on a personal journey of transformation. And in that process, I was able to transform my practice and then started helping other people transform their lives in an amazing way. And so I'm what you call the typical OB-GYN cowgirl. So I have tried a lot of different things as far as getting my health in check. So I've tried all the different diets. And so I tried this diet where you just had 5 or 6 shakes a day. That was it. And I lost about 20 pounds on it. And then I had this horrendous constipation. And I was like, I can't ever do that again. And then I did phentermine, which is an appetite suppressant. And I lost 20 pounds on that. And then I started exercising, doing P90X back when that was popular. My husband and I did that together. And so I lost another 20 pounds. So added up over the course of 2 years, I ended up losing 60 pounds. And I realized I needed to do something different with my job also. So I left my group in 2012, celebrating 12 years of independence actually this year. And then I started, first of all, just regular OB-GYN and doing a little bit of weight loss. Then I learned about bioidentical hormones actually from some of my patients coming in and telling me how amazing they felt. So I got certified in bioidentical hormone replacement therapy. I got board certified in non-surgical weight loss, or what is called obesity medicine. And then I heard about something called functional medicine, and that kind of blew my mind completely. And functional medicine is really all about getting to the root cause. So today, you're going to discover how menopause has caused you to feel like a hot mess, how it has maybe felt like your body has betrayed you as it relates to hormones, as it relates to the metabolics and the emotions. We're going to dive into that. We're going to talk about what labs your doctor should have ordered but didn't, and what you can do now to stop the betrayal and start feeling amazing again. The most natural way to fix menopause, we're going to discuss that today. And there are two parts to this talk. The first part of the talk is where I share with you the things that you can do right now today on your own. The second part of this talk is when I tell you how you and I can start to work together. So there are some challenges faced by doctors and patients related to menopause. One of the things is you just may feel like, can anybody really help me? Because, you go to your doc and a lot of them are unfortunately just clueless in this area. They haven't been trained. They're afraid to use hormones. It's like they don't understand the full story. And so you may go in feeling very frustrated when you leave that doctor's office because you're wondering, can anybody help me? And really, root cause medicine, I think, is a very important piece of this. It's about getting to the root, understanding what's going on underneath. I use this iceberg as an example because I want you to think about traditional medicine is what you see here. It's above the surface. Traditional medicine is often asking the question, what? What do you have? What do we call it? What's the diagnosis? So I can write that down and get compensated from the insurance companies. Whereas if you can imagine underneath the surface, that's where the majority of this iceberg really is. And that's like functional medicine. We go deep, we ask the question, why? We really want to understand what's going on and tackle it from that vantage point. So hormonal decline is part of the problem here. And it's estrogen, progesterone, and testosterone that we're going to talk about first. So let's begin with some of the benefits of estrogen. So certainly it can help with hot flashes, night sweats, and vaginal dryness. If you're having any of those things, getting some estrogen on board is going to help with that. Some of the things you may not know about estrogen is that it actually reduces the rates of colon cancer by about 30%, reduces the rates of osteoporosis by about 30%. Why is this so important? Because 350,000 people break a hip every year. And for any of you that maybe have had a parent or a grandparent break a hip, you understand that their health often declines rapidly after that. So that is a huge issue. And then also 30 to 50% reduction in heart disease, I mean heart attack and stroke. And I don't even have listed on the slide, but there's a reduction in dementia and Alzheimer's for women who are on estrogens in the menopausal years. And then there is progesterone. This is what I call my secret weapon hormone. And the reason why I call it the secret weapon is because this number starts to decline in the 30s and 40s. Progesterone balances the effect of estrogen. Progesterone has a natural calming effect. It helps to reduce anxiety, irritability, and mood swings, and it helps with sleep. And so the aspects that I call the secret weapon is that it helps with sleep, which is huge, and then also helps with mood and anxiety. You may not be aware, but prescriptions for sleep medication and for antidepressants and anti-anxiety medications are through the roof, especially for women at this age. So for those of us in the functional medicine world, we're asking the question, are women suffering from a Prozac deficiency or are they suffering from a progesterone deficiency? And that is to say, not, in some instances, you're going to need an antidepressant, and that's completely fine. But in a lot of instances, what might be needed is actually progesterone. So if we give the body what's missing, that might take care of the problem. Okay, so this is a test of the emergency hormone balance system. It's about to get very serious here. If after the next thing you hear, if your body does not elicit a response, then your situation is more serious than we thought. Are we eliciting a response? I'm waiting, I'm watching. That may be coming through mildly for you, but the song is Marvin Gaye, Let's Get It On. Now, the question is, why don't you feel like getting it on? Maybe it is testosterone. Now, some people mistakenly think that testosterone is only important for men, and that is not true. Other people mistakenly think that testosterone is only important as it relates to sexual benefit, and that is not true either. So, testosterone also starts to decline in the 30s and 40s. Testosterone improves libido and orgasm. Yes, there are non sexual benefits as well, such as increase in energy, increase in mental clarity, building muscle mass over time so that you can burn fat more efficiently. So, testosterone is an amazing hormone, and it is one of the dials that you can turn to really improve your metabolism, also, because that typically starts to tank as well in this H range. So, it's really about restoration. It's about providing the body with exactly what is missing. And the best way to do that, the natural way to do that, is with bioidentical hormones. Bioidentical means that it has the same chemical structure that your body naturally produces. Doesn't mean it's like derived from the ground, but again, it has the same chemical structure as the hormones your body naturally produces. And there is a difference here. So, not all hormones are created equal. Uh, Bioidentical and synthetic can have some very different outcomes. And unfortunately, a lot of the traditional doctors do not understand this. So here is an example. Not all hormones are created equal. Let's take progesterone, for example. So I told you that progesterone is my secret weapon hormone. It is the bioidentical version. What can it do for you? It can actually reduce proliferation of breast tissue. It raises your good cholesterol, also known as HDL. It can help your mood and it can help with sleep. I mentioned that. Now, if we take the synthetic, what is technically called a progestin, not progesterone, it goes by the name of medroxyprogesterone acetate. It's also in the product called Prim Pro that a lot of women get for menopause. This is linked to weight gain, disturbances in the mood instead of helping the mood. It reverses the benefits of estrogen, and it has been specifically linked to an increased risk of breast cancer, heart attack, and stroke. So you can see there is a huge difference between the bioidentical and the synthetic, but most doctors, unfortunately, do not know that. So, how do you achieve your menopause makeover? Let's say, even without hormones, there's some things that you can do. So, you can keep your ovaries if you're having a hysterectomy, because that will help you transition naturally and not abruptly cut off your hormones if your ovaries are removed. A low carb diet will help you. One of the what I call menopause pretenders is actually if you're overeating in sugar and high carbs, and that can give you sweats, especially at night. Exercising will help, optimizing your nutrition, and taking your vitamin D will help you in that menopause transition. And speaking of nutrition, I want to talk a little bit about the Dirty Dozen. I don't know how many of you have heard of the Dirty Dozen, but the Dirty Dozen are the 12 most chemical laden produce. And so these are the ones, if you have to choose, what should I buy organic? These are the ones that you should definitely buy organic. It has gotten to the point, and you'll see probably some of your favorites are on here, like strawberries, like apples, grapes, even kale. And kale and spinach are healthy, but you need to get them organic if you can. And so it's gotten to the point now, especially like with apples for sure, like I cannot eat a non-organic apple. It's like I can taste all the chemicals in it. And so these are the ones that you need to get organic if you're choosing. And then there are some natural supplements that can help with menopausal symptoms. Things like black cohosh, chaste tree, magnesium wild yam, and DIM, diindolyl methane, which is found in cruciferous vegetables and also in supplement form. These are some of the ways that your body can be helped through the menopausal transition with some natural supplementation. So again, it is your hormones like we talked about, but it's not just your hormones, or it's not just those hormones that you're thinking about, but there's also thyroid, which is another very important hormone. So what are some of the symptoms related to a thyroid that is not functioning well? Well, if you take a look at this list, and if you go back to what I talked about at the very beginning, as far as the symptoms of the hot mess syndrome, a lot of these things are very similar. And so that's why it's important for you to get a full comprehensive blood panel to understand what's going on in your body, because what you might think is thyroid may be menopause, and what you think is menopause might be thyroid, or it might be both. How many of you are experiencing some of these symptoms? And my next question is, how many of you have had thorough labs to really check it out? And some of you have had labs and you're like, well, my labs are normal, but I still have symptoms. Why is that? Well, the spectrum to diagnose a thyroid issue is quite wide. Typically, this lab called TSH, thyroid stimulating hormone, is the main one that is used to diagnose a thyroid issue. It goes from zero point 0.3 to 4.5, and you have to be above 4.5 to indicate an underfunctioning thyroid. So it's kind of opposite. Higher TSH, your body signaling in a higher manner that it needs more thyroid. But unfortunately, if you go to your doctor and you say, "Hey, doc, I'm tired, I'm constipated, my eyebrows are thinning, my hair is thinning, I'm cold all the time, I think I have a thyroid issue." Well, you go in and they check the TSH, and if it's 4.2, they're going to say, "I'm sorry, ma'am, it's not your thyroid, it must be something else. Are you depressed? Do you think you need an antidepressant? Maybe that'll help you feel better." I literally had a patient tell me one time that her doc said, "You know what? I'm not sure what's going on with you, but I can give you an antidepressant so you can forget about it." That is sad, but that is actually the state that some people are dealing in when it relates to their body not feeling optimized. And that's the key. It's all about optimization. It's not good enough to be normal. Who wants to just be normal and feel crappy, right? Normal is not optimal, but optimal is best. And that's what we're getting to. So let me share a success story. I have a few of them sprinkled throughout today because I want to share stories of people that I think you may be able to relate to and understand, like, hey, if they went through this and got better, there's hope for me too. So I want you to be encouraged in that. This is Dina. She's going to share her story.
Okay, tell us your name. I'm Dina Ruddick. And tell us why you first came to Dr. Well, I had gained about 50 pounds over the course of about 3 years. And so I knew something was wrong. So I was tired all the time and just didn't feel like doing anything and slept a lot, actually. So I knew something was off. And I'd been talking to a girlfriend of mine at work, and she'd been telling me about these bioidentical hormones that she'd been on. And I'm like, let's see if I can find out, somebody who does that around me. So then I went on the website and I found you guys and started coming here in November of 2015, and I've never felt better. I've lost 37 pounds, and well, since that time, about a year, a little over a year. And good. What is different that has stuck out that is different from traditional doctor's offices or physicians you've been to in the past? Had you tried anything else? Yes, I had thyroid problem, right? So I was on some synthetic thyroid, I can't remember the name of it, but it didn't make me feel any better, and nothing changed. And that's kind of what prompted me to start looking at the bioidenticals was that it just wasn't working for me, the synthetic ones. And then I started coming here and doing all the hormones and the thyroid treatment, and it's just made the world of difference in my life. How does this differ from your primary care or the medicine that you've gotten before? How does this office differ? As far as the people? And anything, just in general. Well, it's just like I just feel completely different than I did when I was on the other treatment. I mean, I'd never had any other hormone treatment like progesterone or testosterone or estrogen. I mean, they were just like, they pretty much told me, well, tough. You can't do anything about it. And I'm like, that cannot be the answer. There's just so much scientific, science that is going on right now that people have done so much with medicine and stuff like that. So I was just like, there's got to be another answer. Then, well, there's nothing you can do about it. So tell us how your experience, how often do you come in? What's your experience like in the office? And how do you feel about, coming to the doctor's office so frequently? I was coming every 2 weeks at first, and it seemed like that might have been a little bit too much for me. Not overly hormonal or whatever like that, but I decided to started going every 3 weeks, and it's awesome. And so I drive all the way out here every 3 weeks because it's worth it. And I just love you guys. I mean, all you guys are just wonderful, fun and funny, and make me feel really welcome. And I actually enjoy coming out here. I look forward to it. Not too many people can say that about their doctors. That's exactly right. And so tell us, looking back at when you first started coming here, and what your expectations were. Like, do you feel like you have met the goals that you set? Do you have new goals that you didn't think about? Like, what's your life? How has it changed? Well, honestly, my expectations are completely exceeded. I just wanted to feel better. I wasn't expecting to drop all the weight. And I mean, I was hoping a little bit would come off, but this is pretty drastic.
Yeah.
I mean, 37 pounds is pretty good. It's still going. I mean, every month I lose a little couple more. I'd like to get back down to my goal weight, which is probably about 10 more pounds. But yeah, it's an incredible experience. And, I've never had an experience like this with a doctor's office before.
Awesome. Anything else that you want to add or say?
I would highly recommend coming to Dr. Woods, and she'll make your life feel better.
Thank you.
Mhm.
So I just love that story because I think so many of you can relate to Dina because she was like, I just don't accept that. I believe there's got to be more to it. And you guys are those, what I call true health seekers like Dina. So I wanted you to be encouraged in that. Let's talk about another hormone, cortisol, which is the stress hormone. Let's talk about the connection between cortisol and belly fat. A lot of women during this time are dealing with increases in weight, fat around the middle. I can't tell you how many women even on video, they stand up and show me right here, like, look at this. This was not here before. So, what do we see with cortisol? Increased stress causes increases in cortisol. And there are different types of stress. So, there is the emotional or the perceived stress that you feel. Then there is dietary stress. So, there are foods that you may be eating that do not agree with your body. And then there's pain and inflammation, which is another type of stress. And so cortisol stimulates insulin, and insulin promotes fat storage. So if you're dealing with stress, that's also another issue. So you may be thinking, how does my stress level really affect my menopausal weight gain? Well, let me tell you a story about Linda. She was in her 60s and she came to us because she was looking for functional medicine. And with our guidance, just jumping to the second paragraph here, she realized she had an adrenal issue, again, related to cortisol. With our guidance, we made some recommendations and changes for her. And she said, I have lost 13 pounds almost effortlessly. Wouldn't that be nice? And she did it by slowing down, being more conscious about her decisions. That's how your cortisol can affect your weight. So the key to the natural menopause fix is really a comprehensive approach. You don't want to go just to the, hormone shop on the corner because they're not going to look at the entire body. That's where functional medicine comes in. It's taking a comprehensive deep dive approach to what's going on. Again, we talked about digging deep and going under the surface. Let's talk about what it means to work with a functional medicine team. And so I want to encourage you on this notion that it's time to break the old habits. And I want you to break the habit of trying to get healthy via what I call the HAP method. I'm making a note to myself here. What is the HAP method of trying to get healthy? Hoping and a praying. Okay. I say that in jest, but I also say that in love because a lot of you who are the true health seekers, kind of reaching and grabbing for this or that. You're in the Facebook group and you're talking to your friends and you're watching this podcast or listening. And so you're trying things haphazardly, but you're not getting any results. And so my question is, are you going to continue on that old path or are you ready to take a new path? Now, I know what you may be thinking, like, hey, I've tried everything. I don't have the time. How do I know if this is really going to work for me, what Dr. Woods is talking about? The reality is you don't have a system. Again, you're sort of haphazardly doing things without a system. And that's exactly what me and my team have been working with patients on for the last 9+ years. And that's why I'm excited to introduce you to a root cause approach that's personalized, enlightening, and will set you up to see amazing outcomes, help you achieve the natural menopause fix that you desire and deserve. Let me share another story with you. This is Michelle, and she's going to tell you what she experienced and how she achieved her breakthrough.
Okay, so tell us your name
My name's Michelle.
and what initially brought you to see Dr. Woods.
A year ago, I was in chronic pain and stressed out and just really didn't feel good at all. So I finally made myself go to the doctor and was diagnosed with Hashimoto's and borderline hypothyroidism. And they wanted to put me on levothyroxine and stopped trying to do anything else. So I found Dr. Woods through my neighbor and just wanted to kind of get to the root of the issue and solve the problem rather than just taking medication to cover it up.
Okay, and how has the process changed your views on traditional medicine?
it's just verified everything I found about traditional medicine. I don't go to doctors, but I tried. So it just makes me happy that there are natural ways to handle things and changes you can make in your life without having to put chemicals in your body to do it. I'm glad they're there because
Right.
it's good for some people, but
And so, how has your life changed? How have your symptoms changed? What is different now than a year ago?
um, I would say it was about 4 or 5 months ago whenever I got with Dr. Woods. So since coming here, I've learned that I'm highly gluten sensitive. Taking that out of my diet has been the biggest thing for me, I think, because all of the pain and inflammation that I was feeling keeping me from exercising is gone. Well, I'd say 90% gone. I mean, we're still in the process, but I'm able to exercise again. I've lost 30 pounds.
That's
I
awesome.
have a lot more energy, and I don't know, just my whole outlook on life is just more positive, and I don't know, I look forward to each day rather than dreading each day.
How has it changed your health changing? How has that impacted other aspects of your life, like relationships or work or things like that? Is there any change?
It's good. My relationship with my husband is good, and because I feel better, I'm able to be there more. Same thing with my children. I've actually, in the last 4 months, had record months at work.
Wow.
I'm in sales, so that's been good. Another big thing is the adrenal fatigue in stage 2, stage 3, or was. I haven't retested yet, but and I've implemented meditation and breathing and the exercise. I think a lot has helped, but just not as stressed out as I used to be. So I think everybody, I mean, I'm always a fun person, but I can also like be like, ah. So I feel like that's decreased dramatically.
So everybody's benefited from it,
Yeah.
even if not directly. What advice would you have to somebody who may be feeling kind of like you were, that there's not very many options out there, or they're just tired all the time, and they don't know necessarily? You did a lot of research on your own, but what if they don't know what the next step to take is? What would you say?
I would say definitely have your fluids tested so that you know what is going on instead of guessing. You can Google anything, you can guess anything. A lot of symptoms overlap, but with doing the blood and urine and stool and saliva, we were able to narrow down exactly what was going on with me, and it helps you find what you need to work on and baby steps. It's a lot at first, and the changes are a lot, but if you stick with it, I mean, the benefits and the way you feel, the way you look, everything is like, I feel like a completely different person than I did a year ago. So.
Okay, so again, that's another great story about figuring out, getting to the root cause. Not only is she feeling better, she's looking better, she lost weight, and she's having record numbers at work. So it's amazing what can happen when you figure out what's going on from the inside out. So, what is the next step? Well, I want to invite you to schedule your root cause strategy session plus lab panel. What does that mean? Well, we're going to review your history and assessments, and we have a detailed form for you, intake form, we call it, for you to complete. Probably unlike anything you've ever done at your doctor's office. We want to know all about you, your history, and all the things that may be contributing to your health as it stands today. Some of that may have happened even in your childhood. So we want to explore those things. And then we're going to spend 90 minutes together. And I want you to ask yourself, how much time do you typically get with your doctor? I know some people say 10 minutes, 15 minutes. If you're lucky, maybe you get 20 plus. But we get to spend 90 minutes together to take a deep, deep dive. And then we're also on that 90-minute call, we're going to review your functional health report. And that's a way for us to look at your comprehensive lab panel from the perspective of how do we optimize your health versus just being satisfied by being normal or not normal. And then I'm going to develop a personalized, comprehensive specialty testing and recommendations for you so you understand what your next steps need to be. And so I want to ask you a few questions. So if all the root cause strategy session got you was a better understanding of what's going on in your body, would it be worth it? If all the root cause strategy session got you was more energy and motivation to improve your health, would it be worth it? Answer that question for me. And then, if all the root cause strategy session got you was the key to achieve your natural menopause fix, would it be worth it? What would it be worth to have more energy, to lose that menopausal belly bulge, to get your sexy back, to know your root cause solution? But I want you to think about this. Is your health an expense or is it an investment? It really should be an investment. And when is the last time you invested in yourself? So many of us, especially women, we pour into everyone else but ourselves. We put everybody first and we put ourselves last. But your health really is your greatest asset. And so, what does your insurance really pay for? We don't take insurance here at Dr. Woods Wellness. If you have a flex spending account or an HSA, you can use it, but we don't communicate with insurance companies. That requires a lot more red tape, that requires a lot more staffing. We just want time to spend with you as the patient, help you through your journey. The way I look at insurance is sort of like car insurance. Car insurance will pay if you have a wreck, if you bust your windshield, but your car insurance does not pay for tune-ups and it doesn't pay for gas. So when we're talking about optimization, your traditional medical insurance is usually not going to cover that. So again, it is the root cause strategy session plus lab panel. We're going to review your history and assessments. Maybe for the first time, you're going to get really heard. And we're going to treat you as a whole person and not just looking at one aspect of your health. We're going to spend 90 minutes together. You're going to get a comprehensive lab panel and a full functional medicine health report to tell you what's going on in your body. And I'm going to walk you through all of that line by line. And then you're going to get a comprehensive personalized recommendation on what your next steps should be. And you really have two choices. Number one, you can continue on your current path. Maybe be frustrated and things like that. Choice two, you can take what you've learned today and take action and get an accurate assessment of your health through the root cause strategy session plus lab panel. If you're taking option one, you're going to try this on your own, continue to struggle with your hormones, continue to feel frustrated and stressed, and just trying to just work it out on your own. Or if you take option two, you can learn from the proven system that has helped thousands of people. You can change your life, your relationships, your confidence in your health. I shared the stories with Dina, with Michelle, with Linda. They were able to do that. And you can work with a dedicated team who wants you to win. We're here for you to win. And if you're ready to make a change, you're going to go with option two and decide to work with us. So if this sounds like what you want and you want to optimize your health and your hormonal health, so who is the program for? It's for those of you who have tried everything to improve your hormonal health, but you had little to no results. This program is for you if you want to learn a healthy and sustainable way to optimize your health now and into the future. This is for you if you have low energy, poor sleep, imbalanced hormones, digestive pain. Here's the deal. When you're dealing with one thing going on with your health, there are often other issues that we can optimize. And again, we want to look at you as a whole comprehensive being. I don't just want to deal with your hormones. I want to make sure you're sleeping well, your mood is right. We talk about the emotional, the spiritual. We talk about all of those things here. And if you're willing to invest in yourself, this program is for you. This program is for those who feel they are worthy of having the health and body that they have dreamed of. I want you to think about this. Information alone is not enough. Lack of information is not the problem, right? Everybody has Google, they have access, but yet having all of that information has not brought you about to your solution. So it's the right information plus guided action that really gets you to the transformation. That's where we're trying to get to. And I just want to help you and be your guide. This is Michelle. She's actually the one who said, I'm glad I found you so I could get off of Google. That's what she said to me personally. Now, it's not in the 5-star Google review. But she said she realized she had Hashimoto's. She felt hopeless, discouraged. She had anxiety. She was tired, beat down, emotional bag of out of whack hormones, and much more. In 3 months, she lost 26 pounds. She feels better, almost no anxiety. She's not tired. She's sleeping better, feeling overall fantastic compared to when she walked in the door, taking no prescriptions. And so this is the type of, when I say amazing transformation, I'm not just speaking words. I really mean that deep down in my heart because I've seen it happen over and over. So go to the link. If you're watching the replay, just click down below. Again, you'll get immediately taken to our schedule page, and then our team is going to get in touch with you and then get ready for your amazing transformation. So I want to thank you for joining me today. Again, you are one of the true health seekers. You're out there looking to optimize your health, looking for longevity and vitality, and that's what we want to help you do. I'm so excited to share that message. So I'd love to work with you individually. And if you're ready to do that, just click on the link and we would be so excited to work with you. Have an amazing day.